the Chief Compliance Officer of MAC Midwest, formerly known as the Minnesota Autism Center. We're a nonprofit that has 18 locations throughout Minnesota, both in Metro and Greater Minnesota. For 30 years, we've provided a full continuum of mental health services and in-home and center-based EIDBI autism services. The autism provider community understands the importance of Medicaid integrity. We've supported and even led the charge with amazing legislators to get BCBA's license, which just went into effect last year. Provisional licensure for agencies will start this year, with permanent licensure starting the next year. Responsible, trusted providers have invested heavily in compliance infrastructure, internal auditing systems, and new supervision ratios. This leads to a comment that I have to address from the committee hearing in the House on February 23rd, and the false narrative that it has caused and that we've seen oftentimes in news and on the internet. And that comment was that only 6 of approximately 500 unlicensed autism treatment centers in Minnesota have applied for the new mandatory state license, and alluded that's because perhaps they're fraudulent. Let me shed some clarity on that from our own example. MAC is a nonprofit, and we have been for 30 years. We operate on razor-thin margins. At the end of December, prepayment review went into effect, and we were not paid the amount owed to us for 2 revenue cycles. So we are now behind a significant amount of money. We've done everything we can to not discharge any clients, which is about 300 in our centers, 300 assessment only, so about 600, or to lay off any staff, which is about 550 staff. We've worked diligently to secure line of credit and cut all non-essential expenses. So working in that financial reality, we were told we needed to revalidate all locations, which for us is 18 centers. This is hundreds of pages of documentations, and it's a $700 per center revalidation fee. As mentioned, we need to apply for provisional licensing also before May 31st, which is about $1,200 per location, which means that between February and May 31st deadline, we'll have to pay almost $35,000 in fees alone in a time when we're already under such financial strain due to prepayment. At MAC, we've had to weigh these costs with the continued sustainability of making payroll for our staff. We finished revalidation yesterday, and we will take the next 3 months to systematically add our 18 centers, not because we're fraudulent, but so that we can spread the cost of the $35,000 in fees across revenue cycles. EIDBI is not an enrichment program. It's not a daycare. It is not PCA services. It's a prior authorized, medically necessary service treated by evidence-based, scientifically proven intervention under the supervision of a licensed professional. The majority of the kids we serve have nowhere else to go. They cannot go to school. In fact, they've been referred to us from the schools. And parents' last option would be to drop them in emergency rooms, which we know are woefully understaffed and overburdened already. Minnesota's children with autism deserve access to their medically necessary treatment delivered by accountable providers under clear and enforceable standards. I think we can all agree to that. We ask that we continue to stay focused on making this about people and not politics.